7 steps of effective treatment of chronic tonsillitis without surgery. Guys, hello. Today we will talk with you about 7 steps of effective treatment of chronic tonsillitis without surgery. Why without surgeries? Because it seems easier to just go and remove the tonsils. No organ, as they say, no problem. But first of all, not every patient wants to lie on the surgical table. Secondly, not every stationary doctor who deals with this takes the patient for surgery, because there are not always indications for the removal of adenoids. Therefore, knowing how to treat chronic tonsillitis without surgery, conservatively, is important. After watching this video, you will be able to answer the following questions. What is chronic tonsillitis? What are the reasons for its occurrence and frequent exacerbations? Most importantly, you'll be able to answer the question, what can be done to make your throat hurt and bother you less frequently? Secondly, in order to get sick less overall and suffer less from common diseases. Thirdly, what needs to be done to strengthen your immunity, spend less money on medicines, take sick leave less often, and generally improve the quality of your life? What about chronic tonsillitis if you have it? It leads to many limitations. For example, you are afraid of the cold, you're afraid of air conditioners, you're afraid to interact with some sick people around you because you think your immunity is weakened, and many other limitations. Therefore, I hope that if you use the recommendations we will talk about today, you will be able to strengthen your immunity, improve your chronic tonsillitis, and the problems associated with tonsillitis will leave your life. I hope this video will be useful for you. I wish you a pleasant viewing. What is chronic tonsillitis? Chronic tonsillitis is an inflammatory process in the area of the tonsils. Simply put, they are also called glands, and this inflammatory process, to be called chronic, must last longer than 3-4 months. As a rule, chronic tonsillitis manifests itself with frequent sore throats, frequent other discomforts from the throat. This can be a soreness, dryness, coughing. Chronic tonsillitis can also simply manifest itself by the fact that the person often gets sick. Everything depends on how much the tonsils are enlarged and how much the surrounding tissues react because of the sore throat. It is usually associated not with the enlargement of the tonsils and the processes occurring in them, but with the presence of inflammatory changes in the surrounding tissue. When the surrounding tissue begins to react during inflammation, that's when we start to feel pain. That's why pain does not always accompany chronic tonsillitis, because there are few nerve endings in the tonsils. Therefore, in principle, the throat can hurt and bother infrequently on its own, but a patient with decompensated chronic tonsillitis begins to hurt often or almost constantly. In the tonsil crypts, these are passages that go deep into the tonsils, where microbes dig in. Microbes dig in, their cheesy plugs form. All this contributes to the further accumulation of microbial flora. In these crypts, which go inside the tonsils, secretion begins to accumulate. And all this is a good feeding ground for microbial flora. Therefore, microbes are most often this conditionally pathogenic flora, which normally does not cause problems. Rather, pathogenic flora, which has pathogenic factors, that is, those that damage the organism. This flora is chronic, bacterial, it supports the inflammatory process. And if we do not deal with chronic tonsillitis in a timely manner and do not reduce the inflammatory process of the tonsils, then even chronic viral infection may join. But usually, if a chronic viral infection is already joining, then the patient simply does not get out of respiratory diseases and the throat is practically constantly bothering. The causes of chronic tonsillitis are usually an untreated acute inflammatory process, that is, acute inflammation in the tonsils. Roughly speaking, angina, which was not treated in time, gradually launched a chronic inflammatory process which usually subsides over time. But in addition to the main reasons, that is acute tonsillitis and the presence of microbial, often viral flora, there are many other factors that affect the work of the tonsils, the work of our body, and the work of the immune system. And actually, for effective treatment, it is necessary to act on all mechanisms. So I think it's basically clear what chronic tonsillitis is, and we can now move directly to the 7 steps of effective treatment of chronic tonsillitis. Step 1 is to consult an otolaryngologist. Why is it important, first of all, to see an otolaryngologist? Because you need to understand what kind of chronic problem is in your throat. Is it really chronic tonsillitis, or is it chronic pharyngitis, which is usually a result of the influence of other organs and systems or the result of external factors? Therefore, you need to first see an otolaryngologist to establish a diagnosis, whether there is really chronic tonsillitis or not. Secondly, what needs to be done at the otolaryngologist's appointment is to determine the indications for tonsillectomy. If such indications are present, then probably it is better to actually part with the tonsils and forget about the problem. But if these indications are doubtful or they are not there at all, and the tonsils do not seriously complicate your life and do not spoil it, then you can of course try, and you need to try, conservative treatment of chronic tonsillitis. The indication for tonsil removal is, above all, complications on other organs and systems. If, for example, you have a joint disease, you turn to a rheumatologist. The rheumatologist diagnosed reactive arthritis, measured anti-streptolysin, which shows that you have a lot of streptococcus in your body, and the joints gradually begin to get involved in the inflammatory processes. And then, God forbid, to deteriorate. Of course, you don't have to wait until chronic tonsillitis breaks and other organs of the system, other joints, and timely get rid of tonsillitis. But if there are no indications for removal, then of course you need to be treated conservatively. Therefore, first we turn to an otolaryngologist. Secondly, we determine the indications for the removal of tonsils at the reception. If there are none, then we start active conservative treatment. Step 2. It is desirable to take a swab from the throat at the ear, nose, and throat doctor's appointment for chronic bacterial infection for flora. I warn you right away, everyone's throat is not sterile. There are always microbes in the throat, and they are sown in everyone, including a patient with chronic tonsillitis. But the microbes that have been sown do not mean that they must necessarily be killed by some long, overwhelming courses of antibiotics. We are just looking at what kind of flora it is, whether it can cause complications to other organs and systems, and we take into account the sensitivity of these microbes in order to reduce their quantity. Also, with chronic tonsillitis, I usually recommend taking a pine cone with almond and saliva. To Epstein-Barr viruses, cytomegalovirus and herpes simplex virus type 6. Because if a chronic viral infection is detected, it means that the antiviral immunity is not working well. And it is necessary to definitely involve a good immunologist to strengthen the antiviral immunity. In order for the chances of recovery and success and for a long-term remission of chronic tonsillitis to be higher, that is, summing up the second step, we take swabs for bacterial flora and sensitivity to drugs, and we take scrapings for Epstein-Barr viruses, cytomegalovirus, and herpes simplex virus type 6. This study is conducted using the polymerase chain reaction method. Step 3. For successful treatment of chronic tonsillitis, it is also important to exclude the influence of neighboring organs. This is primarily the influence of the nose, that is, if there is some focus of chronic inflammation in the nasal cavity. If this mucus constantly flows into the throat and the tonsils react to this, no matter how much you treat them, if you do not deal with the problems with the nose, chronic tonsillitis will still persist, and the glands will still often bother you. Therefore, if you have chronic tonsillitis, it has a place to be. It is necessary to check the nose, nasal sinuses, to exclude the influence of the nose and sinuses on chronic tonsillitis and on the adenoids. I also always recommend excluding the influence of the stomach, because if there is reflux disease, if there are throwbacks from the stomach into the esophagus and this irritates the throat, then the tonsils can also suffer from this reflux. Chronic laryngitis and pharyngitis, which are inflammations of the mucous membrane and adenoids, are the most common causes. They can either react to this in parallel or they can remain calm at all. Nevertheless, if we see chronic tonsillitis and chronic pharyngitis, then problems with the stomach, and especially these refluxes from the stomach into the esophagus, must be treated and necessarily eliminated. I also always recommend undergoing an examination for a hidden allergic process, especially if some chronic coughing is disturbing. Because if there is a reaction to the inhaled air, then the effect of treating chronic tonsillitis is also reduced. Step 4. It is called the sanitation of the chronic focus of infection. Deep within the tonsils, as I've already told you, there are passages called lacunae, so it is desirable to wash out excess microbes from these passages. A procedure called tonsil lacunae washing is performed for this. This can be done with a syringe with a special nozzle. This can be done with a vacuum installation. This can be done with the help of a tonsilo device. In any case, regardless of the method you will use to treat chronic tonsillitis and sanitize your tonsils, this should be done at least once a year, preferably twice a year, to avoid frequent exacerbations of chronic tonsillitis and to make a significant contribution to the treatment of this chronic tonsillitis. Because we flush out excess microbes, as a result, the inflammatory process in the tonsils decreases, the negative impact on the immune system goes away, the immune system begins to recover and actively fights against viruses and microbes that support inflammation. That's why we stop getting sick and the immune system as a whole strengthens. The throat starts to bother much less. Therefore, be sure to sanitize your tonsils. I usually recommend doing this every other day, and the number of such procedures usually ranges from 5 to 7. If problems still arise, for example, it happens that the tonsils were flushed with a course and a month later the problems formed again. And often one procedure is enough to flush them out and they don't form again for a month. So sometimes we use other schemes, that is, flushing the tonsils as needed. However, if the courses of sanation do not give enough effect and a lasting result, then probably it is better to get rid of the tonsils. Step 5. Creating ideal conditions in your homes, maybe even at work, for your immune system to function. I often talk in my videos about how our local immunity depends on the consistency of the mucus that covers our mucous membranes. And the more moist our mucous membranes are, the better our local immunity works. Because immune cells and antibodies, which actively fight viruses and microbes, float in the mucus. Therefore, it's important to create optimal conditions in our homes and ideally at work for our local immunity to function. I won't go into detail on this issue. Be sure to check out the links in the descriptions below. I will definitely leave you a link to a video called Creating Ideal Conditions in Your Homes for Local Immunity Work. So you can watch this video in detail, how and what needs to be done. But in 2 words, I will literally tell you 2 important factors. The first is the air temperature, which should not be more than 24 degrees Celsius, otherwise the mucous membranes begin to dry out. And humidity, which should not be less than 50%. To lower the temperature, we cover the radiators. To increase the humidity, we buy an air humidifier. If you create ideal conditions for the immune system to work, your local immunity will work much better. Accordingly, chronic tonsillitis will flare up less often. You will catch viruses and microbes that come at you from outside less often. Accordingly, the less often you get sick, the less often tonsillitis will flare up, as a result of which the chronic inflammatory process can decrease. Step 6 is called a healthy lifestyle, proper nutrition and hardening of the body. Regarding this step, which is essentially such, in fact probably the most difficult one, because it's very popular now and we all hear it all the time. This is a healthy lifestyle, proper nutrition, but not every patient is ready to engage in this because this, as everyone thinks, is not tasty, it's too complicated, it's for some kind of twisted people, and this probably is all difficult. In fact, it's not all that complicated, because if you eat right and cook and prepare very tasty food, then you get pleasure from it. If you live correctly, act correctly, those changes in your life that you introduce with a healthy lifestyle, you can also get pleasure. That's why I recommend it to you. It's a very complex problem. To pack it into this video, that's why I will definitely leave links in the description. Watch my next videos. One is about how nutrition affects our body. The second video is about how our body is affected by sleep and rest. Because these are such two big global problems. If we rest properly, our body starts to work better and our immunity strengthens. If we eat properly, our immunity also strengthens. The body works more, works better, and we get energized. So be sure to watch these videos. In addition to giving some good results for treating chronic tonsillitis, you will appreciate the other benefits of these health improvement methods for your body. I will focus separately on hardening, because I have not yet recorded a separate video about hardening. Hardening is a way of life where you are not afraid of the cold, because if we are afraid of the cold, adrenaline is produced. The vessels of the respiratory tract spasm, the formation of mucus is turned off, our mucous membranes start to dry out, and the local immunity does not work, we start to get sick. Therefore, hardening is training the body not to be afraid of the cold. It is better to harden with the help of water procedures. It's best to do this in the morning. You woke up, brushed your teeth, cleaned up, and took a bath. The first week we rinse our feet with slightly cold water. The second week we rise to the knees. The third week we rise to the waist. The fourth week to the stomach. The fifth week to the chest. And the sixth week we are already pouring ourselves together with the head. The most important thing is that we lower the temperature gradually, and the exposure time should not be long. That is, it's just a few seconds for you not to have time to freeze, but nevertheless the body, it will learn not to react to the cold, and you will get sick less often after hypothermia. That is, even if you do get hypothermia, you will get sick less often after such hypothermia. In conclusion, if you lead a healthy lifestyle, proper nutrition and hardening, it will undoubtedly have a positive effect on chronic tonsillitis. And in addition to your throat being less troubled, you will strengthen your body as a whole, boost your immunity, and gain extra energy. Be sure to try, be sure to watch my videos in the description, which are dedicated to a healthy lifestyle, proper nutrition. Step 7 is final. In case of chronic inflammation. In the glands, there is usually a huge big reason for the chronic inflammatory process, apart from the reasons we have already discussed with you. It's overstrain, and this chronic fatigue and some chronic stress situation which hit our immunity and our organism very hard. You've probably heard that all diseases come from nerves. Indeed, it is so. We, doctors, are already encountering the aftermath of some influences on the organism. And first of all, in order to achieve success in treating chronic inflammatory diseases, including chronic tonsillitis, we need to try to eliminate the problem. And it is already proven that especially when, for example, we identify a chronic viral infection in the upper respiratory tract, in the lymphoid tissue, there is usually some chronic stress situation and patient fatigue. Usually the patient is constantly overstrained, he has some psychological problem that interferes with his life and so on. Therefore, it is very important. If you have chronic tonsillitis, you are constantly sick, try to normalize, first of all, your life. Try to remove stress from your life. Try to remove stress from your work. Just think, just sit for a day or two, a few days at leisure. Think about the meaning of life in general, about where you are striving and what you want. The meaning of life, as many say, is to become happy, and another question is what makes you happy? We don't always know the answer to the question of what makes us happy. Therefore, try to delve into yourself and try to find out what truly makes you happy. Ask yourself, what makes you happy? And by answering this question, you might come directly to a concrete result. You will understand what truly makes you happy and strive for it. Here are these some kind of machines. Suburban 3-story houses are not always necessary for us. For happiness, as a rule, we need warmth and care for our loved ones. Not so much how much we care, but how much they care about them. Therefore, please analyze your life, your work, and eliminate chronic stress. If you narrow down your goals, we really don't need much for happiness in this life. Therefore, if you narrow down your goals and cut off all the excess, you will realize that you don't need much to be happy. Therefore, I wish, drawing a conclusion to the 7th step, for you to determine your life goals, remove and cut off all the excess, stop working. Like, I don't know, some horse and step from morning till night. You need to rest more, and you need to spend more time with your family and loved ones, and then you will be more peaceful, more happy, and your immunity will start to increase in response to this and will fight the chronic bacterial and viral infection itself. I wish you to cope with all your problems, if you have any. But if you have chronic tonsillitis, then on 95, I'm sure there are also problems related to work, chronic stress, and so on. So be sure to resolve them. Guys, write your questions in the comments if you have any. Be sure to write about any problems, methods of treating chronic tonsillitis that you find useful, which I have not told you about. I will try, if you have any questions, to answer all your questions, so I am waiting for your comments. Guys, as always, we talked a lot about various medical standards and other different spheres of our life. And it seems like I've told a lot. And when all this information starts to pile up, we start to fear it. But there's no need to fear it, because everything is simple. I believe and I'm confident that each of you will be able to implement all of this into your life. It's simple. Go to an otolaryngologist, take tests for flora, for chronic viral infection, exclude the influence of other organs and systems, create optimal conditions in your homes for your immune system to work, rinse your tonsils, go for washing lacunae, tonsils. At least partially introduce a healthy lifestyle into your life, proper nutrition and hardening. And most importantly, try to figure out the goals of your life to become happy, to strengthen your immunity, and to become healthy people. All of this is really not that difficult, so I wish for you to succeed. I wish you health, I wish you happiness. See you on the channel. Bye. Created the subtitles.